Imagine stepping into your grocery store, food assistance card ready, only to find out there's a new list. A list of things the government says you just can't buy with it.
Right. It sounds a bit jarring, doesn't it?
It does. And, this isn't some far-off hypothetical. For millions of Americans using SNAP, that's the Supplemental Nutrition Assistance Program, what we used to call food stamps, this is becoming reality.
Exactly. We're seeing this push from several states now, and it's got federal backing.
Yeah, to restrict buying certain foods, the ones often called junk food. But the big question, I guess, is this really about making people healthier? Or is it just adding another hurdle, another layer of complexity for people already struggling?
That's the core tension, isn't it? Is it health policy or something else? It taps into ideas about choice, poverty, and even the history of what we think is acceptable food.
Okay, so that's what we're diving into today.
Precisely. We'll try to unravel the reasons behind these new rules, look back at how food aid has changed over time, and explore some maybe surprising arguments against these kinds of bans.
We'll look at what SNAP is supposed to do, what people actually buy with it, and if there are other ways to encourage healthy eating.
Yeah, alternatives that maybe don't involve bans.
Right. Our mission here is to understand the impact on people, learn from the past attempts, and see what the experts think actually works. Okay, let's unpack this.
So where do we start? The breaking news seems like the place.
Definitely. Because things are changing fast. Just recently, August 5th and 6th, 2025, the Trump administration gave the green light, approved waivers for 6 more states.
6 more. Okay.
Yeah. West Virginia, Florida, Colorado, Louisiana, Oklahoma, and Texas. They can now restrict SNAP purchases of things like soda, candy, sugary drinks, snacks.
And that's on top of others earlier this year, right?
Exactly. It brings the total to 12 states now. Arkansas, Idaho, Indiana, Iowa, Nebraska, Utah were approved before, so a dozen states moving in this direction.
Wow, okay. And what exactly are they restricting? Is it the same everywhere?
That's where it gets messy. It's definitely not the same.
Yeah.
Texas, for instance, is going pretty broad. Soda, energy drinks, candy, and prepared desserts.
Prepared desserts, huh?
Yeah. Louisiana is slightly different: soft drinks, energy drinks, candy. Then you have Colorado and West Virginia, at least for now, focusing just on soft drinks.
Just soft drinks, okay.
And Florida, like Texas, is including prepared desserts, which seems unique among this latest batch. So, yeah, what's banned in one state might be fine right next door.
Which you can imagine creates a whole lot of confusion, not just for people using SNAP, but what about the stores? The food companies?
Absolutely. How do you even define junk food consistently?
That's the million-dollar question.
Yeah.
Look at Indiana and Nebraska both banning soft drinks. But they define soft drink differently. One might ban something the other allows.
Seriously, how different can the definitions be?
Well, Indiana's is broad, basically any non-alcoholic drink with sweeteners.
Yeah.
Nebraska's more specific. Carbonation, sweetening agent, flavoring.
Yeah.
It gets technical.
Okay. Yeah.
And then Iowa. They've got really restrictive, banning sugar-sweetened drinks with less than 50% juice to get sodas, sure, but also maybe some flavored waters, drink mixes.
Wow.
And their definition of candy is huge. It includes stuff like fruit leather, some granola bars unless they have flour, even trail mix potentially if it has candy pieces.
Fruit leather, granola bars, that seems expansive.
It is. Imagine running a small corner store trying to keep track of whether this granola bar has flour but that one doesn't. It's a huge administrative headache.
Yeah, I can only imagine. Now, who's really pushing for this? We mentioned federal backing.
Right. A key figure is the Health and Human Services Secretary, Robert F. Kennedy, Jr. It's part of this Make America Healthy Again, or MAH initiative.
MAH, okay.
Secretary Kennedy Jr. has been pretty clear. He stated that, in his view, SNAP uses taxpayer dollars to fund soda and candy, and that these fuel chronic diseases like diabetes.
So the argument is public health and taxpayer money.
Exactly. He says these waivers put real food back at the center and empower states. Governor Greg Abbott in Texas echoed that, talking about promoting better, healthier food habits.
And the Agriculture Secretary.
Brooke Rollins, yes. Also praising these efforts, mostly from Republican-led states, as promoting healthier options for families in need. End quote. The stated goal is very much about health and responsible spending.
And you have to acknowledge there are real concerns about obesity, diabetes.
Oh, absolutely. Advocates frame it as aligning assistance with public health goals. If the government is helping pay for food, it should be, healthy food. That's the logic. Nudging people towards better choices.
So for millions of people, the checkout line is about to look different starting in 2026. But is this the first time we've tried this? You mentioned history.
Not at all. This debate is, well, It's almost as old as the program itself. To really get it, we need to look back.
Okay, let's do that. Where did it all begin?
Way back in 1939, actually. The first food stamp program. And it had two goals, which is fascinating. One, help the poor get food during the Depression.
Makes sense.
And two, help farmers by distributing surplus crops they couldn't sell.
Ah, supporting agriculture too.
Right. And they had this two-stamp system. You bought orange stamps for regular food, and for every $1, you got 50 cents in free blue stamps.
Blue stamps.
Yeah, and those could only be used for specific surplus foods, often fresh fruits and vegetables. So there was an early kind of incentive, you could say.
Interesting. And restrictions, did they exist back then?
They did, surprisingly early. By 1941, they were already restricting things like ginger ale and root beer soft drinks from being bought with the orange stamps.
Wow, 1941.
Yeah, but natural fruit juice was okay. The records aren't perfectly explicit on why, but it strongly suggests a nutritional reason. Or maybe thinking of soda as, like, non-essential, even back then.
Okay, fast forward a bit. What happened later?
Well, the 1960s were key. The Food Stamp Act of 1964 defined food really broadly. But, and this is crucial, the House tried to exclude soft drinks, luxury foods, luxury frozen foods.
So they tried to ban certain things then, too.
We did. But the Senate shot it down. And their reason. They said it would cause insurmountable administrative problems and defining luxury foods was basically impossible.
Huh. Sounds familiar.
Exactly. The same practical problems we're hearing about today. How do you define it? How do stores handle it? It raises that persistent question. Why is defining junk or luxury food so hard?
It seems like we keep circling back to that.
We do. And the biggest decision on this probably came in 1977. Congress looked directly at an amendment to ban foods with negligible or little nutritional value. They explicitly rejected it. They concluded defining and banning junk food was just too complex. They were worried about the uncertain state of nutritional science, which, let's be honest, is still debated today, and the untold confusion it would cause at checkout.
So practicality won out in 77.
Pretty much. It meant for decades a huge range of foods stayed eligible. It was a pragmatic choice, acknowledging the difficulty.
Then things changed technologically, right? With EBT cards.
Right. Late 90s, early 2000s, we shifted from paper stamps to EBT cards, like debit cards. Fully rolled out by 2003.
And the name change to SNA.
That was 2008. Renamed the Supplemental Nutrition Assistance Program. The official reason was to reflect an increasing focus on nutrition.
Okay, focus on nutrition. But did they change what foods were eligible then?
That's the paradox. Despite the new name and focus, the actual definition of eligible foods pretty much stayed the same as it was set back in 1977, until these recent state waivers started getting approved.
So 30-plus years of a nutrition-focused name, but no change in the rules about, say, soda or candy until now.
Basically, yes. Which brings us back to that thorny problem, defining junk food.
Yeah, what is it officially or unofficially?
Well, you look it up, like on Wikipedia, and it's generally described as high-calorie, from sugar, fat, often sodium, low in fiber, protein, vitamins, minerals, sometimes called HFSS food, high fat, salt, sugar.
Seems clear enough on paper.
Right, on paper.
Yeah.
But the sources we looked at stress there's still no clear standard that everyone agrees on or that's easy to apply across the board.
Why is it so hard in practice?
Just think about the sheer number of products. Over 650,000 food and drink items out there, maybe 20,000 new ones every year. Trying to classify everything. It's massive bureaucratic grunt work, as one source put it.
Yeah, okay.
And it's wide open to different judgments. Is apple juice junk food? It can have more sugar than Coke sometimes.
Good point.
Or what about that distinction Florida's making with prepared desserts? Is a fruit tart okay, but a cupcake isn't? What about diet soda versus regular? If it's about health, are artificial sweeteners better than sugar? It gets complicated fast.
And you mentioned coffee and tea were excluded way back when.
Yeah, not really because they were junk, but because they were seen as accessory items, not necessities. It just shows how many different ways you can try to draw these lines, and none of them are perfect.
So what's the alternative view on this? If banning specific items is so messy.
Well, the Academy of Nutrition and Dietetics, for example, pushes for a total diet approach. The idea that really all foods can fit into a healthy pattern if you eat them in moderation.
Meaning banning single items might be missing the forest for the trees?
Kind of. It might oversimplify nutrition. And then there's the burden on businesses we touched on, especially small stores, mom-and-pop bodegas.
Right. How are they supposed to manage this?
Exactly. tracking every item, knowing the latest state rules, which are different everywhere. Is this granola bar candy or food? Does this juice meet the 50% threshold? It's a huge ask, and it could lead to errors, fines.
Or maybe they just stop taking SNP altogether.
That's a real concern, which could actually reduce food access in some neighborhoods.
Okay, let's shift gears slightly. There's this argument about fungibility. What's that about?
Ah, yes, fungibility. It's a key point economists make. Basically, money is interchangeable, right?
Yeah.
SNP benefits are supplemental. Most families using SNP, like 70, 80%, maybe more, also use their own cash for groceries.
Right, it doesn't usually cover everything.
Exactly. So the fungibility argument goes like this. If SNP says you can't buy soda, but the family wants soda, they'll just use their cash to buy the soda and use the SNP dollars for, say, milk or bread instead.
Ah, I see. So the total amount of soda or milk they buy doesn't actually change.
Potentially not. They just swap which money pays for which item. The overall shopping basket might look the same, but now there's more hassle at the checkout and higher administrative costs for the program to track all this.
Is there data to back that up? Do SNP users buy differently?
There is. A big USDA report from 2016 found extremely similar food spending patterns between families using SNP and those not using it.
Really? Similar?
Very similar. Both groups spend about 40% on basics: meat, fruit, veggies, eggs, bread, milk. And the kicker? SNP users spend about 5 cents of every dollar on soft drinks. Non-SNP households, about 4 cents.
Wow, that's incredibly close.
It is. It suggests buying patterns for things like soda aren't really driven by SNP itself, but are part of broader societal patterns across income levels.
So banning soda and SNP might not even target the main issue.
That's the argument. Diane Whitmore-Schanzenbach, an economist at Brookings, testified about this. She said bans are unlikely to change consumption patterns because of fungibility.
And what does change, according to her?
Mainly, she argued, it increases administrative costs and, importantly, increases the stigma for recipients.
Stigma? How so?
Feeling judged at the checkout, having certain items flagged as disallowed, it can be embarrassing, maybe even deter people from using the benefits they need, and all without necessarily changing what they eat.
That leads to the human side of this. It's not just about abstract policy.
Absolutely not. Cavell Christie, a health policy expert, put it bluntly. These restrictions effectively control how America's poorest eat.
Control, yeah.
And she argues they ignore the bigger problems, like food deserts, where healthy food is either unavailable or way too expensive. If your only option nearby is a convenience store.
Right. I saw a comment online, someone on the SNP saying, if you're homeless or don't have a kitchen, sometimes convenience stores or fast food are literally your only choices for calories.
Exactly. Telling someone in that situation they can't buy a pre-made sandwich or soda, it doesn't magically make a farmer's market appear. It might just mean they struggle more to get any food.
It feels like putting a systemic problem onto individuals.
That's a common critique.
Yeah.
So if bans aren't the best answer, what is? What are the alternatives?
Are there any that seem promising?
Yes, definitely. Experts often point towards positive incentives, making healthy choices easier, not just restricting unhealthy ones.
Like what, for example?
There was a program in Massachusetts called the Healthy Incentives Pilot, or HIP. It gave SNP folks a 30-cent rebate for every dollar they spent on fruits and vegetables.
A rebate. So like cash back for buying produce.
Essentially, yes. And the results, participants increased their fruit and vegetable consumption by 25%.
25%? That's significant.
It is. It showed that incentivizing the healthy choice works. People responded.
Are there other programs like that?
Yeah, you see similar ideas popping up. Like in New Mexico, offering double bonuses at farmers markets. Your SNP dollars basically buy twice as much fresh produce there.
Oh, wow. That helps the shopper and the local farmer.
Exactly. It supports healthy eating, stretches the food budget, and boosts local agriculture. It kind of hits multiple goals, even going back to those original aims of the food stamp program.
So incentives seem like one major alternative. Anything else?
Another big idea looks at the system level. Agricultural subsidies.
How do subsidies fit in?
Well, right now, most U.S. farm subsidies go to commodity crops. Think corn, wheat, soybeans. These often end up in processed foods, animal feed, sweeteners.
Okay.
The proposal is to shift more of that subsidy money towards specialty crops, that's fruits and vegetables, which get far less funding now.
And the idea is?
If fruits and vegetables were subsidized more, their price could come down for everyone, making healthy food inherently more affordable and accessible, including for people using SNP, without needing restrictions at the checkout.
address the cost barrier directly.
Exactly. Tackle one of the root causes of why less healthy options are sometimes cheaper or easier to access.
So it seems like while the current debate is really focused on what S&P shouldn't buy, maybe the more effective solutions are about supporting what it could buy, making the healthy choice the easier, more affordable choice.
That's certainly what many experts and alternative programs suggest, shifting from prohibition to promotion, you could say.
It really brings us back to that fundamental question, doesn't it?
It does. Is the main goal of S&P to police what individuals are buying, item by item? Or is it to make sure everyone in the country has access to enough healthy, affordable food?
And the history, the research on spending, the incentive programs, they seem to point one way.
They strongly suggest that boosting access and incentivizing healthy options might be more effective and certainly less complicated and less stigmatizing than trying to draw and enforce lines around specific junk foods.
So, given how incredibly hard it is to even define junk food and knowing that money can just be shifted around anyway, maybe all this energy spent on restrictions could be better used.
Perhaps focusing that energy, those resources, on creatively supporting the good choices rather than just banning the perceived bad ones.
Making healthy food accessible and affordable for everyone. What stands out to you about this deep dive?